Sometimes we need to just talk it out. 2025 was a stressful year for many, but having a sounding board and learning a few skills to better handle stress can make a big difference in the new year. Let's welcome Dr. Suzanne Wallach, psychotherapist and dialectical behavior therapy expert at the SoCal DBT Center located in Beverly Hills and Calabasas, California. Glad to have you with us.
Hi, good morning. Thank you for having me.
So dialectical behavior therapy, it sounds different, it sounds kind of complicated, but it actually is quite simple. Tell us a little bit about what dialectical behavior therapy is.
So dialectical behavior therapy, or DBT, if we just want to shorten it, not use that long, complicated word, is basically CBT with a Zen mindfulness component. And when we talk about Zen mindfulness, it's not really meditation. What the developer Marsha Linehan had in mind was really using mindfulness to be aware of what's happening in our bodies and what's happening in the environment around us. And the hypothesis that's a little bit different from CBT, which is cognitive behavioral therapy, is that CBT hypothesizes that you can change your thoughts to change your behavior. In DBT, what we hypothesize is that thoughts are sensations of the brain that we can't change and that we don't have any control over the thoughts that come into our head, but we do have control over how we respond to them.
So you kind of harness the things that you can't change.
Exactly.
And arriving at peace with the fact that you can't change it, but through dialectical behavior therapy, or DBT, as you say, talk therapy is a part of the modality. Yep. Is that correct? So how would you say, if a stressful situation happens in your life and there's no way for you to control it, you can't change it, what's done is done, what is the next step then to kind of come to peace with it and move on?
So in DBT, what we teach people how to do is how to use skills. And we teach skills in four modalities. We teach skills in mindfulness, which is kind of the crux of everything. It's kind of, I always tell people it's the foundation of the house. And then we have emotion regulation, distress tolerance, and interpersonal effectiveness. And we really feel like if you have skills in all of these areas, because you're out of control of people, places, and things, if you have skills to manage all of these areas, your emotions, when you get distressed, and you're mindful of what's happening in your body and the environment around you, and you can be interpersonally effective no matter what happens, that it's going to lead to long-term happiness, and you're going to feel better about yourself.
Yeah. Is this something that you need to kind of build up towards? Do you need to be undergoing therapy or be working with someone before you can embark on something like this? Or can you kind of jump into it cold turkey, if you will?
I think you can do both. So of course, obviously, you can put yourself into a DBT program, which is normally 6 to 12 months long and has many different, you're in group and you're in individual sessions, but a lot of people don't need that intensive program. And so I think skills are something anyone can use or that anyone can be taught or teach themselves. Mindfulness skills, for example, are incredibly useful. There are emotion regulation skills that are incredibly useful. So I don't think you actually need to be in DBT therapy in order to use these skills. They're very accessible to anyone.
Oh, very interesting. And part of it, there's something called radical acceptance. What is that?
Radical acceptance is probably the hardest skill, I think, to use. It's the easiest one to understand, but I think the hardest one to apply on a daily basis. Radical acceptance, when we're talking about it, is really an acceptance of reality. It doesn't mean that you're okay with what's happening. It doesn't mean that you are in acceptance like, wow, I accept this. It just means I acknowledge that this is the situation and that I have to deal with it. And once I radically accept that this situation is happening, then I can move into problem solving.
And what is wise mind? What's
a wise mind is, in DBT, we teach that there are 3 states of mind. So we have rational mind, which I would think of like driving to work or, looking at your bank account and kind of doing your finances. And then we have emotion mind, which runs really hot, which you could think about, I would think about if I had a fight with my husband, or if you're feeling really emotional about something. These days, I think politics becomes very emotion mind. And wise mind is like somewhere in the middle. So we're always looking to find a combination of emotion mind and rational mind, which leads us to wise mind, and asking ourselves, like, what would my wise mind tell me to do in this situation? So instead of leaping impulsively into responding, we always want to stop and pause and ask ourselves, like, is this what my wise mind would tell me to do? And oftentimes just asking yourself that can keep you from making situations worse.
Very interesting. So what can we take away from this for people who are, we're all about to embark on 2026. So a lot of us want to have a better year than the last. So what do you think we can do and start now to start planting those seeds for a healthier 2026?
Yeah, I think 2025 has been a rough one for a lot of people. And I think going into 2026, what I always encourage people to start with is mindfulness. I think start with really paying attention to the cues that your body is sending you. You know, even if it's just starting with an uncomfortable feeling or taking cues from the environment. Like, do I need to take a break and leave? If I'm at work, do I just need to go to the bathroom and splash cold water on my face?
Be kind to yourself. We all deserve it. Dr. Suzanne Wallach, thank you so much for joining us.
Thank you for having me.
We're back in 2 minutes.